Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, coming to you on the last day of Immunization Awareness Month. Had to get it in. It's been a busy month, but in honor of National Immunization Awareness Month, I wanted to go over this very important topic. And I'm going to put the link to join me for discussion in the comments. Okay, just so you can join me in this discussion if you dare. Okay, so thank you so much for the folks that are coming in already. I actually should be in a class right now, but it's like the day's getting away from us, and this is a very important topic. We are about to go into flu season, so I really wanted to get this topic out of the way and under our belts because it's super important. As the mayor of Houston, Texas, Sylvester Turner, announced today during a press conference, August 31st, September 1st, it kind of makes the light bulb go off in your head that, hey, flu season is upon us. Flu season is upon us, and we are in the midst of a pandemic. Now, I'm not going to be an alarmist here, and I will mention that hospitalizations are down in Houston. The percent of positive tests is going down. I think we're down to about between 7 and 8% positive testing, which is down from about 20% a few weeks ago. But the goal is to get to 5% positivity. The initial goal was to get down to 5% positivity by the end of August. So we're close, but not quite there. And this is by no means a reason to start slacking off. We have to continue to fight the good fight. And part of that good fight is getting the flu vaccine. There are a lot of people that are still telling me that they are not going to get the vaccine, the COVID vaccine. It's like, fine, I understand. There are 0 approved vaccines right now. It's very new. We're used to vaccines taking years to be developed and approved and everything like that. And the rush is on. I understand that. But we've got a vaccine that we've been getting for decades that is, with a few rare exceptions, is pretty much safe. And that is the flu vaccine. And Sylvester Turner did say, why not get the flu vaccine? He's getting it. He's getting tested for COVID. And he and the EMS director, my boss, Dr. Percy, did say that Houston has more than enough tests for everybody. They want us all to get tested. We've got more than enough testing, but right now it's encouraged that we all get tested for COVID-19 and we get the flu shot. So I'm praying that we will have less resistance to the flu shot this year, since everyone's waiting with bated breath for the coronavirus COVID-19 vaccine. Please, y'all, go get the flu vaccine. I've been getting the flu vaccine for over 20 years now, and it's done nothing but help. I know people have stories, and there's the talk of Guillain-Barré and everything like that, but I will discuss that later on. And again, I put the link in the comments for you to click on that, and you can join me if you like. Okay. Now, and there's so much information on vaccines, so I'm not going to have like we're not going deep on every single vaccine or anything like that. So, but yeah, whoever is in the comments, oh, thank you so much, Dr. Ken. I know where I should be right now, and I know you're where I should be. You're where I should be right now. But I just had to get this done. Thank you so much, Dr. Ken, for joining me. So let me get to it, because yeah, I'm not as concise as Dr. Ken is, but I'll try. So why am I talking about vaccines so much? You know, it's not part of a conspiracy or anything like that. It's because every year, thousands of people in the United States are hospitalized or are killed by vaccine preventable diseases. And even more than that, millions of us lose days of work, days of school, or we're unable to carry out our responsibilities to our loved ones while recovering at home from illnesses that could have been prevented or at least made less severe by vaccinations. And these same people who are suffering from these vaccine preventable illnesses also go on to infect others. Do you know how many times in the ER I've seen the father come in for the flu? I give him Tamiflu, or we just agree on symptomatic care. He goes out. Then 3 days later, the wife comes in, flu positive, same thing. 3 days later, the kids have it. The same family, everybody's coming in every few days to be treated for illnesses that could have been prevented and illnesses that could be severe and causing unnecessary complications, prolonged illnesses, and things like that, if only people had agreed to get a shot. Anyway, you don't have to do that. So you don't have to get sick from these life-threatening diseases. You don't have to do it. You know why? Because there are vaccines. You don't have to get sick to develop immunity. And for folks that are still talking about having COVID parties and things like that, that's not the safe way to develop immunity to this illness. It doesn't even last that long. It only lasts a few months anyway. So you don't have to do that. Vaccines help us get immunity by imitating a viral or a bacterial illness, and they trigger our immune systems to produce antibodies that eliminate the virus or bacteria if we're ever exposed at a later date. Now, you know, there is a downside. Some vaccines wear off as we get older, and I have treated many an adult patient who only thought that vaccines were for kids. You know, it's not like tricks. You know, tricks are for kids. Vaccines are for kids and adults. They are for kids and adults. Sometimes our immunity that is provided by these vaccines, various vaccines, wears off as we get older. And with the flu, our immunity that's provided by the flu vaccine wears off during the course of a year. And then there might be vaccines that you never, ever received. Some folks don't remember ever getting a tetanus shot, and it may or may not be true, but guess what? The good news is with vaccinations like tetanus or the MMR, aka measles, mumps, and rubella, you can get them again. I know I had the measles, mumps, and rubella vaccine, but I lost my shot records from when I was a baby. And to go on a mission trip with my church a few years ago, I just went and got it again so that I could have a brand new and more recent shot record. Okay. And one thing that I want to put you at ease about regarding vaccines is that the vaccines are not live. So for all those folks who say they got sick from the flu vaccine and all of that, it could be that you had like a dormant viral illness going on, something that you were fighting anyway that was going on, or whatever it is you got could have been a lot worse had you not been vaccinated. So yeah, vaccines are either inactivated, meaning the organism is killed, or the virus is inactivated. So the bacteria is killed or the virus is inactivated, or they are live vaccines, but that means that the action or of the virus or bacteria has been greatly weakened, or there might just be pieces of the virus or bacteria present. And, there might be circumstances under which there's no way around getting the vaccine. If you want to go to certain places, you're not going to be able to get into that country without that vaccine. Again, when I went on the mission trip, the medical mission trip with my church, we stopped off somewhere. I forgot what country it was. We didn't even get off the plane, but we had to get some kind of vaccine, like against typhoid or something like that. But guys, yeah, definitely hit me up in the comments. Let me know that you're here. I appreciate the few of you that are here, and please definitely share this this broadcast. I think I'm gonna take a minute to share also, because this is really, really important, and I want us to start getting ourselves mentally ready for when the COVID vaccine does become available, because they're still saying that it might become available by the end of the year, and certainly definitely early next year. And the more of us who get it, the sooner then the sooner we'll get back to the lives that we are, that we all remembered and loved. So yeah, definitely hit share. I'm gonna share. So you guys join me and share. Okay, so again, like for me with my job, I can't get around getting the flu shot every year. That's why I've gotten the flu shot for the last 20 years. And I think even, by the time I retire from being a physician, I'll be past the age where I'll be amongst the age group where they say you better get the flu shot every year. So yeah, your job, your lifestyle, your health status, or travel requirements might call for you getting additional vaccinations. Like I said, my job requires it. Various travel arrangements that I've had to make, that has required it. So I know what it's like. So let me see if I can share my screen and show you this schedule here. Let's see if I can do this for you. Okay, maybe not that one, but this one. So here we've got from birth, okay? So from birth, you see you've got to get the hepatitis B vaccine. This might be a reminder. It's a good reminder for you guys. And for this information, go to cdc.gov/vaccines/schedule. So you see how we had to get the hepatitis B shot and at what age we had to get the hepatitis B. Then they've got the rotavirus vaccine that, and rotavirus can cause some severe diarrhea. Then you've got the tetanus, diphtheria, and the pertussis combination vaccine. This helps us, with dirty wounds, with whooping cough, things like that. Then you've got the Haemophilus influenza B. So you see the timing there, the pneumococcal, polio. Did you know that there are small outbreaks of polio happening at any given time? Last I knew, there were a few outbreaks in India, and it's because there have been lapses in vaccinations. And that's another thing that I want to share with you, is that, if we let up on vaccinations, these old time illnesses that used to kill ancestors, relatives that from decades past, from the 1900s, early 1900s, things like that. These things will come back. They have not completely gone away, and they're just waiting for us to slack off as far as our vaccination efforts and consistency to rear their ugly heads once again. Okay, so yeah, polio could be coming back. There was an outbreak of the measles in New York State last year that ticked the governor off. So all those things are just waiting. And those anti-vaxxers that talk about how they're fine and better off without vaccines, they're good because the rest of us around them are vaccinated. That's why the anti-vaxxers are safe at this point. So you see that the influenza vaccine is an annual vaccination. There's the live attenuated one. I think this is the inactivated one. So that's the one where, everything's killed. And then this one is the greatly weakened virus there. There's the measles, mumps, and rubella. And we'll go back to the times and you see, okay, so yeah, measles, mumps, rubella is at around a year. So you got the HPV that's coming. So I go down. There's your meningococcal ones, pneumococcals, and then from 18 months to 18 years, here's the remainder of the schedule. And again, this is on the CDC website. Okay, they even have the chickenpox vaccine. I never had the chickenpox as a kid. I was an only child, and my mom didn't let me spend the night at many people's homes. So I never had the chickenpox. So I actually got the chickenpox or the varicella vaccine as a medical student. And there's that Tdap again. You can get that every 10 years in the ER if you have a really dirty wound and you can't remember when you've had it, or if it's been more than 5 years. If it's been more than 5 years, then we'll give it to you again, and it's no harm. It's no harm for you to get boosters of these vaccines earlier than you need to. Okay, so for adults over 60, it's really important, and some sources will say over 50. It's really important that you keep up to date your tetanus shots, your shingles. And shingles is a painful rash, and sometimes it leaves scars, and it can leave scars and sensitivity. It can leave like a burning sensation in the area where you had those bumps and blisters and things like that. It can leave all those things long after the infection is over, and it's caused by the reactivation of chickenpox that you had when you were younger. Now, good news is that if you had shingles already, you can still get the shingles vaccine to prevent recurrence. So that's a relief. That's a relief. You can still get the shingles vaccine even if you had shingles already. Now, another important point as to why people over 60 should really keep up with their vaccinations. And, your primary care doctor is super important for this reason. It's because, especially if you have heart disease, the stress of the infection can cause a flare-up of your heart disease. Depending on how stressful or severe the infection is for you, it could even, it can change your stable angina to unstable angina. Or it could even cause a heart attack based on how severe the infection is. If you have diabetes, illnesses, infections, viral infections, as well as bacterial, can raise your blood sugar to dangerous levels. And I've seen it. I've definitely seen it. So when people come into the ER with unusually high blood sugars and they swear that they've been taking their medication, as prescribed, on schedule, things like that, we go through a review of systems to see if they've been suffering any symptoms of any kinds of infections, because again, diabetes can be thrown completely out of whack by an infection. People can be thrown into DKA or diabetic ketoacidosis, which is like an uncontrolled form of diabetes simply by having an infection. Another disease that can really make us vulnerable to severe illnesses should we come down with a vaccine preventable illness is lung disease. So say if you've been smoking for 20, 30 years and you catch the flu, and a common manifestation of the flu is coughing, things like that. You want to, it can cause a viral pneumonia and cause a superimposed bacterial pneumonia. Flu can make you vulnerable as a virus to a bacterial infection, which can make things even worse. You can have bacterial and viral infections at the same time, okay, at any age. And this is another reason why it's so important for us to get the flu vaccine during this pandemic, because you can have multiple infections at the same time, and it's going to make the recovery that much more difficult. So why not get vaccinated so that you can prevent at least one or two more illnesses? And with being over age 50 or 60 with lung disease, be it from smoking or working around the wrong chemicals, things like that, you are more vulnerable to COVID and other vaccine preventable diseases like the flu. So why not get the flu? Now, unfortunately, there are populations who are not advised to get certain vaccines. Pregnant women and those with weakened immune systems might be advised against getting certain vaccines like the measles, mumps, and rubella, the chicken pox, or the shingles vaccine. They might be advised not to get that, but that is between them and their primary care physician. Hopefully that there's a way to get them. Well, pregnancy, thank God, is a temporary thing, but hopefully, those folks with immune compromise can get to a state where their immune system is such that possibly they can get a vaccine, get one of these vaccines. And so where can you get vaccinated? Where can you get vaccinated? At multiple places. Even if you don't have insurance, even if you don't have a primary care doctor, don't let that keep you from getting vaccinated. We all deserve protection. Hey, Victoria, thank you so much. Thank you so much for joining. I really appreciate you coming on. Don't let a lack of insurance or a primary care physician keep you from getting vaccinated. We all deserve to be vaccinated. So you can get vaccinated at your healthcare professional's office. So like your primary care physician's office, or your, you can maybe even ask your specialist if they have certain vaccines, but mainly start with your primary care physician's office first. You can go to various pharmacies to get the flu vaccine. You can go or check with your local health department. Many cities have health clinics throughout their areas where you can get those kinds of get that kind of treatment and other treatment, primary care treatment as well. And you can go to your community health clinic to get those, and community health clinics are often connected with the local health departments. And for many of us in the healthcare profession, our workplace practically makes it mandatory that we are vaccinated, at least with the flu vaccine. And most health insurance plans do cover vaccinations, but I swear, doctors, many of us are not experts with insurance. Definitely call to make sure first, make sure that you are covered. But for at the very least, they should be covering the flu, and pharmacies will verify that with you as well. So, what about this? The concern for Guillain-Barré with the flu shot. What's the concern with that? Okay, and first of all, what is it? Okay, so yeah, Guillain-Barré, it's not completely understood, but and they call it a syndrome, GBS. The S stands for syndrome, and it often follows infections with viruses or bacteria. And each year here in the United States, an estimated 3,000 to 6,000 people will develop it. Most people recover fully from GBS, Guillain-Barré, but some do have permanent nerve damage. And its studies suggest that people are more likely to get Guillain-Barré syndrome after having the actual flu. It's more likely that they'll get it after the actual flu than after the vaccination. And let's see. And then more data on an association between the seasonal influenza vaccine and Guillain-Barré. While they've been variable from season to season, when there is an increased risk, it's consistently been in the range of 1 to 2 additional cases of GBS per million flu vaccine doses. So for every million doses of flu vaccine administered, there may be 1 to 2 cases of Guillain-Barré syndrome, but luckily, most of us recover completely from that, while there is some permanent nerve damage. And I've seen those YouTube videos of the people, with who report having GBS after getting the flu vaccine. But take it from me as someone who's gotten the flu vaccine from multiple healthcare institutions, all the places that I've worked at or trained at over the last 22 years, I've never had any ill effects of that. And let's see, where have I've gotten flu vaccinations from? The University of Maryland, where I went to med school. I got them at Howard University, where I did residency. I've gotten them from various drugstores, Walgreens, various freestanding ERs and hospitals that I've worked at. I even got a flu vaccine as well as the pneumonia vaccine, the pneumococcal vaccine in Chicago's Midway Airport, because the University of Chicago was offering them at my terminal. Like I've gotten them in multiple places, and I've done nothing but well getting the flu vaccine. So let's see, how long has it been? Okay, we're coming up on 29 minutes. If anyone has any questions or anything like that, let me see. Let me just put this up for you for your information. Let's see here. Oh, that's from last night's Perspectives in Primary Care. Do check out the Perspectives in Primary Care Facebook page, where we did an episode in honor of Chadwick Boseman on colon cancer. I know that he would want us to learn from him and not go through what he went through while he was doing all the great things that he did. Okay, so here is the a primary source there. So for more information, go to www.cdc.gov/vaccines. I hope this helps you guys. And yeah, that's where I got the vaccination schedule from. And please, the pandemic is making it more important than ever for us to get the flu vaccines. Get the flu vaccine now before too many people become ill. Get the flu vaccine now, especially if you have children who are going to school. Those viruses aren't going anywhere, pandemic or not. The bacterial and viral illnesses that are passed around at school, those aren't going anywhere. So flu, strep, hand, foot, and mouth disease, and all the other little viruses that don't have a vaccine, like, adenovirus and, the coronavirus, be it COVID-19 or the other coronaviruses that cause the common cold, those aren't going anywhere. So why not make an illness less complicated by getting vaccinated? I'm Dr. Kadisha. Thank you so much for joining me. Do share this episode and hit me up in the comments. Let's see. So Victoria says, why did she get really ill after getting the flu shot? She heard that one can't get ill from a flu shot, but I was sick and ended up with pneumonia. Often people have things that are uncovered by getting the flu shot. We can carry around, especially viral illnesses. We can carry around viral illnesses with no symptoms until our immune system is stressed by something else. That's why typically you are not vaccinated unless you are feeling great. I've had many a patient, especially children, who were due to get vaccinations, but their physician put off the vaccinations because it was clear that they were ill. Sometimes we're not clearly ill, and the vaccine will unmask something that we were successfully fighting against. Okay, so that's one thing that could have caused that. Another school of thought is that it might have been much worse had you not gotten the flu vaccine. And again, viral illnesses, and not just the flu, viral illnesses and the stress of fighting those illnesses can make us vulnerable to bacterial super infections as well. So yeah, it's other than that, it's hard to say, what perfect storm was brewing inside of you when you got that vaccine. I hear that all the time. You're not alone, but viruses are really sneaky things, and you could have something and feel just fine until something unusual happens. You get vaccinated, and and then it just wreaks havoc. There are so many viruses out there that we don't have vaccines for, that we don't have treatments for, that it could have been anything. It could have been anything that caused you to get so sick. Any of those other viruses. We've got rhinoviruses, adenoviruses, we've got coronaviruses, and then different types of influenza viruses that give us cold and flu symptoms every year. Also, another thing is that the flu vaccines don't cover every single strain of the flu, unfortunately. They don't cover every single strain of the flu, and that's why we have to get a different flu shot every year, because they're trying to figure out which strains are going to be most problematic year to year. And sometimes one of those strains is not covered, unfortunately. So that's a great question. And you definitely got me prepared. That's the first time I've had to say that this year, I know I'm going to be saying it when I go back to work. I'm sure I'm going to be saying that when I go back to work and I have a patient with flu-like symptoms, and the nurse and I asked, oh, did you get the flu shot this year? And they say no, because I got really, really sick last year. There's so many viruses out here that I can't even name them. And unfortunately, there's no vaccine, there's no treatment, but they still make us sick. So thank you so much for that question. And I guess I better, I don't know what's going on in class. I see Dr. Ken's not commenting there. Something must be going on in class. So, but I'm Dr. Kadisha. Thank you so much for joining me. And I also want to give you guys a free PDF on how to be well and be safe during the pandemic. And this is to be well and be safe during any viral season. As we go into flu season, now combined with the pandemic, the advice in this presentation is even more important than ever. So definitely go to drkadisha.com. That's www.drkadisha.com, so that you can get that free presentation. And while we wait for the coronavirus vaccine, the COVID-19, and I know plenty of us are going to be waiting even when it's available, we're going to wait a few months to see what happens to everybody else, to see, who gets sick or worse during the first few months. While we wait for that, we all need to be safe and have our own personal mini mobile MD kit that I've made just to help keep all of us safe. It's got masks. It has surgical masks, reusable masks, sanitizer, even gloves for specific tasks. The gloves aren't supposed to be worn long term, but for a specific task, say you want to, pump gas or something, you use the gloves, throw them away, make sure your bare hands don't touch the outside of the gloves. And last but not least, they also come with forehead thermometer strips, so that the moment you feel a fever coming on, you can pull out your own personal forehead thermometer strip. And those are reusable as well, to see exactly what your temperature is. Because there are still places that aren't doing the temperature checks, but they're allowing multiple people in one space, unfortunately. And you want to be able to know what your temperature is should you feel a fever coming on, so that you know what to do and how to act accordingly. So go to drkadisha.com for your free special presentation and to get your mini mobile MD kit. They come in black and clear. The reusable masks come in multiple colors, and I've got the mask with the valves and the mask without the valves. And I know the CDC says that the valves make, while they're more comfortable to wear, they don't protect, they'll protect you, the wearer, but they don't protect the people around you so much. So when you're around other folks, you can use one of the surgical masks that I provided in the kit to put it on top of the mask. Or what I like to do is wear a surgical mask on the inside of my mask with the valve, because I like the color or something. I don't know. The surgical mask looks better to me on the inside of a mask with a valve than it does on the outside. So yeah, I don't blame you. I don't blame you, Victoria. There's going to be a lot of people not taking it. But, one reason why we don't have the vaccine right now is because they are making sure that it is safe. And then that does remind me, I'm supposed to go over an update. So the COVID vaccine update, let's see here. So there are a number of vaccines in development. I think, there's like over 20 vaccines in development right now. And but there's and they're at various stages of safety. And let me bring that up. Let me bring that up here. Let's see if I can. Bring that up. Yeah, the vaccine tracker. Okay, so I'm going to share this with you guys. So here's the New York Times article, and let me get that out of here. Not ready for a free account. So here's the New York Times, the coronavirus vaccine tracker, and this was dated today. So as you see, thank you to Jonathan Coram, Denise Grady, Swee Lee Wee, and Carl Zimmer. You see, it's updated today, August 31st. We've got 23 vaccines where they're testing the safety and the dosage. Phase 2 vaccines in expanded safety trials. 3 vaccines in large scale tests of their efficacy, tests of their effectiveness, and we've got 3 vaccines that are approved for early or limited use, 3, and 0 approved for full use. And yes, vaccines typically require years of research and testing. Yes, they do. But, just for the sake of the world and for the sake of the lives that we need to get back to, the race is on to get vaccines done. So as you see, researchers are testing 36 vaccines in clinical trials on humans, and there are at least 90 preclinical vaccines that are being experimented with in animals, hopefully safely with animals. But okay, so, and those things are meant for us to develop antibodies to this coronavirus organism. Okay, so it's been going on since January. The first safety trial started in March. Things are uncertain. Some will fail, but some are going to make it. Okay, so that's the New York Times coronavirus vaccine tracker. So guys, definitely share this. You see, I'm sharing this good information with you guys. Definitely share this information as well. So another reason to share this episode, to share this broadcast. And oh my goodness, so now we're almost at 45 minutes, but I hope that helped you with me showing the schedules, the vaccination schedules, and showing you the worldwide vaccine tracker courtesy of the New York Times. So definitely share this episode, share this information. Let us get mentally prepared to get up on our vaccines with this pandemic going on. The last thing we need is to become severely ill with a vaccine preventable illness in addition to COVID. And becoming ill with anything is going to make you vulnerable to another illness. Becoming ill with a bacteria or a virus can make you more susceptible to a bacteria or a virus. Again, I'm Dr. Kadisha. I'm your board-certified emergency medicine physician, best-selling author of the book, Help Us Help You in the Emergency Room. That book is crucial. If you ever anticipate a visit to the emergency room, or if you've ever been to the emergency room for yourself or a loved one, this book will help you avoid a lot of the frustration, miscommunication, possibly repeat testing. It will save you time. It could easily save you money if you get this book, because it's what my 20 years of experience has taught me, and as well as the frustration of 20 years of patience has taught me. All of that is in the book. So definitely please get that book, and definitely get the Mini Mobile MD kit so that for yourself and a loved one, don't just get one if you live with, a whole family. If you live with 3 or 4 other people in the house, get one for every person in the house. If you have, someone who's of advanced age living in the house with you, don't just get it for yourself, get it for them too. So that we can all be safer together while we wait for this vaccine, while we wait for the safety of this vaccine. So definitely check me out. Check out this free presentation at drkadisha.com and tell me in the comments other things that you would like me to talk about. We got a request to talk about peripheral neuropathy during perspectives in primary care. That was one thing that we may cover. And I thank you so much. And until next time, be safe, be well, and be successful. Thank you so much. Bye.